So we're going to talk about safe sleep for baby. So even though it isn't natural for babies to sleep on their back, this is actually the safest way for them to sleep. When they are little and they can't control their airway or protect it, we want to make sure that it's safe. So the safest thing for them is to be flat on their back with a surface that is flat, that doesn't have any other loose blankets or anything else in the crib. We want to avoid crib bumpers or anything like that. And when baby is sleeping, you do not want them in a swing or anything where their head could be sideways, because in a swing, or even if you are leaving them in a car seat, their head can go sideways and that can actually block their airway, and we don't want to do that. So the safest place for them to be sleeping is to be by themselves in a separate area, flat on their back. So babies will sometimes in the beginning, you will just notice a lot of sounds coming from baby. They might sound like they're kind of gurgling, or they're just like kind of grunting a lot. And that actually can be normal. Some babies just really are uncomfortable on their back, but with time, they get a lot better and a lot used to this. Usually by a couple months of age, they aren't doing this anymore. They're just more used to being on their back. And if you are swaddling them up, that can help them be more comfortable on their back too. So it actually is safe for you to give your baby a pacifier. It actually is one of the protective mechanisms against SIDS, which is that sudden infant death syndrome. That's what we're trying to prevent with them staying on their back. So actually giving them the pacifier where they're sleeping is actually safe. So that is okay to do. And if you have like a fan on in the room, that can actually be a protective thing for baby also. We just want to make sure there's nothing loose in the crib as far as like pillows or blankets or anything like that where they could accidentally get their airway covered.